Georgia is seeing improvements on most COVID-19 metrics across the state. On average, there are about 6,700 new cases per day. And while that's still high, we haven't seen averages like this since the start of August. Another place we're seeing improvements is the number of COVID-19 patients in the hospital. Tonight, healthcare workers are caring for more than 3,600 COVID patients. Where we're seeing things get worse is the number of Georgians dying each day. On average, we're losing 176 people to the virus every day. And Ron, Pfizer is hoping that they have come up with a new pill that will help prevent some of these severe outcomes.
Yeah, you know, Jennifer, this could be absolutely groundbreaking because Pfizer says it's testing a pill that could help ward off COVID-19. So if the pill is successful and approved, it can be prescribed at the sign of infection, preventing patients from being hospitalized or placed in critical care. So the announcement left folks with a lot of questions out there, right? 11 Alive Hope Forward breaks it all down with the help of a medical expert.
Pfizer, testing a pill that could keep you from getting sick if you're around someone with COVID-19. Sounds like the vaccine, right? Well, no. 11 Alive's medical expert Dr. Sujatha Reddy says it actually reminds her of another type of treatment.
This treatment sounds very much like Tamiflu, which people may have heard of. We give that to people that are exposed to the flu or early on in their diagnosis to try to keep them from getting very sick.
Like Tamiflu, which is different from the flu shot, the COVID-19 pill would not be a substitution for the vaccine.
It should help people that may be living in a home with someone who has coronavirus or have been exposed to coronavirus. It should prevent them from getting a very bad infection because these medicines keep the coronavirus, in this case, from duplicating itself.
And while some people on social media claim the drug is essentially ivermectin repackaged, Dr. Reddy explains the two are not at all the same things.
Ivermectin is an anti-parasite. Often it treats worms. So that is a different mechanism of action than an antiviral.
In the end, if the drug works and is approved, Dr. Reddy says it'll be helpful, especially for people who refuse to get the vaccine.
Vaccination right now is still the main thing we have in our weapons to fight this pandemic, but having more medications can only help us. So I think it's great news that we're seeing that there's medication out there being tested.
Pfizer is also studying this potential treatment in people who are already infected with the virus. The drug maker expects those results by the end of 2021. Now, we know that you all have a lot of questions about the vaccine and COVID-19. We've put together all of the facts we have for you in one place. Just check out 11alive.com/vaccine for everything you need to know.